Assalamualaikum and good morning to one and all. Today we'll start with the part 4 of the pharmacoepidemiology. So before going ahead, let's quickly see what we have studied in the part 3 of this chapter. So in part 3 of this chapter, we have studied about new design, that is cohort study. What is the difference between the cohort study and the case control study? So that we have seen in a detail, and we have also seen about different statistical parameter that we used for interpretation of result of cohort study and case control study. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to discuss randomized clinical trial of pharmacoepidemiology and explain different types of pharmacoepidemiological studies and its application. So let's start with the randomized clinical trial. First, we'll see about the definition of randomized clinical trial. So it is the study in which the investigator control the therapy given to each participant. So participant, it is most of the time not aware about what treatment it is given. So it is called as randomized clinical trial. So this treatment protocol, it is completely controlled by the investigator. So what investor is doing, so when he has to give treatment to the participant, he will randomly allocate patient to different types of the treatment. For example, the 5 set of the patient will be receiving drug A. These 5 set of the patient which are randomly allocated will be getting the drug B, and they are not aware whether which patient is receiving drug A and which patient is receiving drug B. Okay, so this type of clinical trial, it is called as randomized clinical trial. So it is very important and a very good type of the design of the clinical trials, and also it is used in case of pharmacoepidemiological studies. So let's try to understand randomized clinical trial by using the case study. So in this case study, we are randomly allocating sexually active women specially to use either oral contraceptive or no contraceptive. So we are making all those women that we have selected, all are sexually active women, and they are at the age of childbearing age. So they are having childbearing age, so they are sexually active women. And what we are giving, which medicine we are giving? We are giving oral contraceptive to one group, and to another group we are not giving oral contraceptive. So now when we give oral contraceptive to one group and when to another group when we are not giving oral contraceptive, so that group it is called as unexposed group, and to whom we are giving oral contraceptive, that group it is called as exposed group. So when you expose drug to the patient, now especially in case of oral contraceptive, we have seen that it produces the venous thromboembolism. So now you can easily compare after randomly allocating this patient that how they differ in their incidence of subsequent venous thromboembolism. So is there venous thromboembolism? It is seen in case of patients who are on the treatment with oral contraceptive, and there is no sign and symptom of venous thromboembolism in the patient who are unexposed. If this is the case and you have also allocated group randomly, so there is no chance of what we'll say the intentional variable, isn't it? Because you have randomly allocated sexually active women. So when you are allocating such women randomly and when you are giving oral contraceptive to one group and not giving oral contraceptive to another group, and if venous thromboembolism, if it is seen in case of those who are exposed to the drug, so that clearly indicate that, or this is the strong indication rather, that oral contraceptive or venous thromboembolism, it is associated with the oral contraceptive. So here you can completely conclude your study. So we are not able to conclude in case of the case report or in case of analysis of secular trend and other type of study, but these are the two design that we have seen. Once we have seen in last lecture, that was the cohort study, and second one it is the randomized clinical trial. With the help of these two study, you can conclude about the association between venous thromboembolism and oral contraceptive. So from day one we are looking at this example, how we have concluded this case of the venous thromboembolism which is associated with the oral contraceptive. Okay, so this is about the case study. Now let's see about the strength of the randomized clinical trial. What is the important strength of this study? Okay, so the major strength of this approach, it is a random assignment. So random assignment that you are doing, it is the major strength of this study, because if you are doing random study, then there will not be any psychological effect in case of patient. Sometimes patient even respond to the placebo because the patient know that he is taking the medicine. So it's something which is looking same as the drug. If you are giving to the patient, he may say yes, I am getting the effect of the drug, because some patients are the placebo respondent. So there could be the possibility of psychological effect when you know, or when patient knows what medicine he is taking. But in case of randomized clinical trial, since investigator allocating the patient randomly and patient is not aware about what medicine he is taking, so there is very less possibility of such a psychological effect or psychological response which is seen in case of the patient. Okay, so this is the major strength of this approach or the randomized clinical trial. So the study group are comparable in potential confounding variable that are either unknown or unmeasurable. Now what could be confounding variable? Like you are not aware, or investigator it is not aware that in particular patient what are the different confounding variable. Confounding means it is something which is not known, which is something which is confusing to the investigator. He is not really aware about what are the different factors that might be seen in that particular patient. For example, you are giving drug to the randomly selected patient. He might have the certain problem in the body that investigator it is not aware of. He might have some certain set of genetic makeup that investigator is not aware of. So such patient, when they are randomly allocated, so these patient will respond to the drug in a different way. So that is the beauty of this study, and you will get opportunity to measure all those responses. So the study group are comparable in the potential confounding variable that are either unknown. So these variable are not known to the investigator, or these are variable which are unmeasurable in nature. Okay, so this is the first strength. The second strength could be, for this reason the association demonstrated in the randomized clinical trial are likely to be causal association. What do you mean by causal association? So you are not aware that whether the problem which is produced by the drug, it is really due to the drug, or it is due to some genetic abnormality it is there in the patient. So these whatever association it is established, it is the causal association, and due to the causal association that is developed, okay, and the factor are not in the control of the investigator, you may get various response to the drug, right? And due to that, it will help you to represent different population in that particular area. So that is another important, what we'll say, the advantage of the randomized clinical trial, or the strength of the randomized clinical trial. Okay, now let's see what is the problem associated with this type of the trial. So there are certain problems. So one problem, it will be impossible to perform ethically and logistically. Now how it is impossible to perform ethically and logistically? Now since you are randomly allocating the patient, maybe by sometime maybe by just taking the cheat and you are writing the name of the patient and then randomly selecting those cheat and allocating the group. So this could be one of the way, but there could be different method can be used by different the people who conduct a clinical trial. Okay, so since you are randomly allocating the group, maybe one group must expose to the drug, right, and another group may not expose to the drug. So it is not ethically possible to justify or to do justice of exposing drug to the particular patient. So one patient or group of the patient receiving the placebo, another group of patient may be receiving the drug. So since you are doing all these randomly, so it will be impossible to perform ethically and logistically. So this is the one of the limitation or the problem related to the that is the randomized clinical trial. Okay, second could be, in addition, randomized clinical trials are the expensive one. Okay, so these are expensive clinical trial because you need to recruit the patient, whereas in case of earlier study you have not recruited the patient, especially in case of retrospective study. Retrospective study, you haven't recruited the patient, rather patients suffer from adverse effect, that is venous thromboembolism or death, it is happen in the patient, and what you are doing, you are looking at its medical record, you are checking their medical file, and based on the medical file you are doing the analysis and comparing that with those who are not receiving the oral contraceptive, right? So since here you are actually recruiting the patient and then you are giving the medicine to the one group and you are not giving medicine to another group, so in such cases you need to give remuneration, you need to provide the food, you need to take care of those patients. So in turns there are some expenses which are lies in case of randomized clinical trials. So these are the expensive and they are also artificial in nature, where patients are not suffering from the disease for which you are giving the medicine, so you are randomly allocating. So these are artificial trials. Okay, so these are the two important problems which are related to randomized clinical trial. Now let's see how we are doing randomized clinical trial, and when generally although we are doing it as one of the pharmacoepidemiological study, but do remember that the randomized clinical trial, they are generally or they are already being performed prior to the marketing. So if you see the phase 1, phase 2 or phase 3 study, one of the study design in this case of clinical trial, it is the randomized clinical trial. So phase 1, phase 2, phase 3 study, these are the study that you are doing before marketing the drug into the market or before launching the drug into the market. So most of the time these studies are already being done prior to the marketing. So before marketing you have already done this study, but in case of pharmacoepidemiological study, they are likely to be used in case of pharmacoepidemiological study mainly for supplementary study of the drug efficacy. Now what could be supplementary study of drug efficacy? For example, you have launched the drug into the market by performing the phase 1, phase 2 and phase 3 study, and now the drug it is already into the market, right? So you know that the drug having certain set of efficacy. Now after drug it is launched into the market, if there is the doubt on that study, if there are some outcome that you have received after giving that drug into the patient or large number of the patient, which are the doubtful one or which are not directly going with the data that you have received with the phase 1, phase 2 and phase 3 study, then to confirm that you can conduct additional study. So when you conduct additional study, such type of study, it is called as supplementary study to ensure the drug efficacy. So although it is done prior to the marketing, but when you are doing pharmacoepidemiological study, it can be done as a supplementary study to verify and confirm the drug efficacy. Okay, so this is what in case of pharmacoepidemiological study related to randomized clinical trial. So although it is a supplementary study, but do remember that they remains as a gold standard by which other design must be judged. Okay, so unless and until you are not performing two important type of pharmacoepidemiology study, that is the cohort study and randomized clinical trial, you are not going to confirm your assumption. These two study, the cohort study and randomized clinical trial, it give you a data, supporting data which help you to confirm your assumption or to conclude your assumption. Yes, now you can straightforward conclude that now it is confirmed that the venous thromboembolism, it is associated with the use of oral contraceptive. So we have used this example from all type of study design, but we have seen in case of earlier study design we are not able to conclude it. We will make the statement like it may be happening due to this, but we are not unable to conclude it. But after this study you can confirm and conclude about the venous thromboembolism and their association with the oral contraceptive. So this was just one case study I have taken throughout my the part or the four chapters or the units of this chapter of epidemiology, but there are a number of such examples. So this is just for your understanding. Okay, so I have done with my first part of today's session. Let's go ahead with the question and answer session. So my first question is, what is randomized clinical trial? Yes, so let's see who give the first answer. I am waiting for your answer in the chat box. So the one who give first answer, he deserve the appreciation. Yes. So what is a randomized clinical trial? Okay, so Nurun Nisa mentioned that it is the study in which investigator control the therapy. Yes, so she is right. Investigator control the therapy, but here the most important part, I think Altaf has given the answer. It is the study on the random. You are randomly allocating the patient. So investigator, he randomly allocate the patient, especially in case of randomized clinical trial. Okay, so that is the beauty of this study. Rafiq has mentioned the study in which investigator control the therapy given to each patient. Yes, you are right, Rafiq. I can see the Rafat has also given the same answer. That is the randomly allocating the patient. Okay. Shaista also mentioned about the study on randomly allocating the drug. Saqib has also given the same answer. Yes. So it is the first of all, it is a study which is controlled by the investigator. And investigator, he randomly allocate patient to given treatment, and patient has no control on what treatment he will get. Okay, so that is important part of the randomized clinical trial. Now my next question is, what are the problems which are associated with the randomized clinical trial, or you can say the limitation of the randomized clinical trial? So we have seen there are two limitations or the two problems which are associated with this study. So may I know what are those two problems? I can see the first answer, it is given by the Nurun Nisa. She mentioned that it is expensive and artificial study. Or yes, it is expensive because you need to recruit the patient. Very good. What could be the other reason? One, it is expensive and it is artificial. What could be the other reason of this? I can Saqib has mentioned it is difficult or impossible to perform this study ethically and logistically. So logistically performing this study, it is difficult. You need complete hospital setup because you are recruiting patient on your own risks with the help by taking their consent. So it is difficult to perform this study ethically and logistically. So these are the two important problems which are related to randomized clinical trial. Okay, so I have done with the question and answer session. Let's move on to the next part of the today's session. It is categories and type of pharmacoepidemiological studies. Okay, so now let's see what are the different categories or type of pharmacoepidemiological study. So pharmacoepidemiological study, it is now we have also seen about the different design of pharmacoepidemiological study. So don't get confused. So whatever we have studied, that was the case report, or then case control study, then analysis of secular trend, the cohort study, and randomized clinical trial. All these are the design of pharmacoepidemiological study. So these are the different design of pharmacoepidemiological study. Now what this slide it is saying, it is about the categories and types of pharmacoepidemiological study. So don't get confused. So there is difference between the different type of design of pharmacoepidemiological study and different types of pharmacoepidemiological study. Now let's see what are the different types of pharmacoepidemiological study. So pharmacoepidemiological study, they are broadly classified into two categories. Okay, so the first category it is observational studies. So these are the study which are just observational study. So based on your observation, what you are doing, you are collecting the data, you are applying different statistics. So that you have seen in last lecture. We can calculate what we'll say, that is the excess risk. We can calculate the odd ratio, the p-value, then confidence interval. So all this we can apply to interpret the result of those observation. So the first type of study, it is observational study. So let's see what we are doing in observational study. So in observational study, the investigator, he measure the parameter but does not intervene during the study. So he doesn't control what medicine is to be given to the patient. He will not change the protocol. So he has recruited the patient to whom physician has already prescribed certain set of the drug, and another patient to whom physician has not prescribed other set of the drug, right? And those patients are not captive in the hospital, so they are not kept in the hospital, they are going at their home, and you are just doing the observation, you are asking for the question, and you are verifying what is the result of that, right? So these are just observational study. So investigator just measure the parameter but does not intervene during the study. So he is just measuring the parameter, he is just doing the observation and collecting the data. Okay, so let's see the example of such study, like the case report we have seen. It is the example of the observational study. The case series, it is also observation, it is also one of the observational study. Then analysis of secular strain, that is also called as ecological studies, it is also observational study. Then case control and cohort study, so these are all observational study. Okay, so here you are just collecting the data, you have not recruited the patient who are in your control, what they are eating, right? So that is what food they are taking, everything it is on their, they are doing on their own at home. Okay, so this type of study are called as observational study. Now second kind of the trials or second type of pharmacoepidemiology study could be interventional study. Now in case of interventional, the name itself indicate that it involves the active attempt to change the disease parameter, for example the exposure. So now we have seen just now we have seen the example of randomized clinical trial, where the investigator control what medicine it is to be given to the particular set of the population. If that is the case, then such type of trial it is called as interventional study, because here the investigator doing active attempt to change the disease parameter, right? So you can change what drug it is to be given, what food it is to be given to the patient. So all those parameters you can actively control as the investigator, or you can also control the progress of the study by the treatment. So if at all during the process of the study, if you feel that you need to change the treatment protocol, investigator can change the treatment protocol which is given to the patient. Okay, so interventional study, it involves the active attempt to change the disease parameter, that is the exposure, or also to change the progress of the disease by giving particular line of the treatment to that particular patient. Okay, so example of such type of study are called as the clinical trial. So all phase 1, phase 2 and phase 3 study are interventional study. You can do the amendment in the protocol with the permission of the ethical committee, right? So that we have seen in case of the last chapter of the drug discovery. So the clinical trial, it is the interventional study. The field trial that you are doing on the field, so we'll be seeing this in a detail, because clinical trial we already studied in drug discovery chapter. So those type we have not studied in those chapter that we'll study in today's session. Okay, so the field trial, it is also one of the interventional study. Third one, it is community interventional study, it also come under interventional study. Okay, so let's see one by one what are these different type of the trial. So the first, it is the field trial. So what you are doing in field trials, so these are the trials which are conducted outside clinical setting are called as the field trial. What you are doing in clinical trial, you are recruiting the patient who stay in your hospital, isn't it? Whereas here you are although recruiting the patient, but you are giving medicine and asking them to go to the home. Okay, so these are the trial which is conducted outside clinical setting are called as field trial. So it generally involve participants who are living at home in their normal environment. So you do not have control on what environment they are living in. Okay, so they are living in the normal home environment rather than being captive in the hospital or outpatient clinic. So in case of clinical trial, you are keeping that patient in the hospital, or you are keeping that patient in case of the outpatient clinic, isn't it? Whereas in case of field trial, you are giving the medicine, those patients go at home and they are living in their normal environment, and just when they come back to you, you are asking them certain set of the question in the interest of getting some information related to the efficacy and adverse effect of that particular medicine. Okay, so if that is the case, then such trial are called as the field trial. So one important difference between the clinical trial and the field trial is clinical trials are conducted especially in case of the hospital, whereas the field trials are conducted at home. You are giving the medicine, asking patient to go at home, take those medicine, and then on the basis of the questionnaire you are gathering the data. Okay, so that is called as the field trial. So most of the trials of the preventive measure such as the immunization or health education are the field trials. Now what could be the example of immunization? So nowadays people they are taking COVID-19 vaccine. So after taking COVID-19 vaccine, you tell me, is it the right option to keep that patient in the hospital? It is not practically possible because large number of the people they are immunizing. So you are giving vaccine to them for the purpose of immunization. So it is not practically possible. So what you are doing, you are keeping the record of those patients, you are taking the phone number of those patients, and you are asking those patients to go at home and report if any adverse effect they are suffering from. Isn't it? So this type of trial of immunization or something which is related to the health education are the field trial. Then let's see what is the important difference. So we have already seen this difference between the field trial and clinical trial. So one difference we have seen, the clinical trial conducted in hospital setting or clinical setting, and field trials are conducted at the home. You are giving medicine, asking patient to go at the home. Another important difference between the field trial and the clinical trial is the inclusion and exclusion criteria. In case of clinical trial, there is very strict inclusion and exclusion criteria. Now, what could be inclusion and exclusion criteria? I will give you some example. For example, in case of oral contraceptive, the trial, the inclusion criteria could be those female who are at the age of the childbearing age, or those female who are already married and they are sexually active. So this could be the inclusion criteria. What could be the exclusion criteria? The exclusion criteria could be those who are non-smoker. So those who are the smoker could be the exclusion criteria, right? So if you are doing the study only on the non-smoker, then smoker could be exclusion criteria. If you are doing study on the smoker, then the non-smoker could be the exclusion criteria. So you are not taking non-smoker because your study is related to the smoker. And in case of the smoker, you are not taking non-smoker, so you are excluding all non-smoker and you are only recruiting all those women who are a smoker, right? So this is the inclusion and exclusion criteria. It is very stringent in case of the clinical trial, whereas in case of the field trial, the inclusion and exclusion criteria that may be less stringent in the field trial than the criteria often imposed in case of the clinical trial. So this is another difference between the field trial and the clinical trial. So I hope you understood what do you mean by field trial and you are able to distinguish between the field trial and the clinical trial. Okay. Now next type of the epidemiological study, which is the interventional in nature, it is community interventional studies. Now let's see what is community interventional study and what we are doing in such kind of study. So community interventional trial are an example of a broader class of the studies, and they are called as the group randomized trial. So it is also called as the GRT. So don't get confused. Sometime in exam it comes like the community interventional trial, or it is also called as the CIT, community interventional trial, or it is also called as the CIS, that is called as community interventional study, or it is also called as the GRT because you are conducting this study in particular group, or it is also called as the group randomized trial. So these are all same term. Okay, so what we are doing in such study, investigator he randomly identifies certain set of group. Now what could be certain set of group? We have seen there are certain drug they react in different way in Eskimos population. There are certain set of the drug which react in different way in case of the Jews population. Why? Because this set of population they are having different genetic makeup, right? So to particular community you have identified and you are giving the medicine to those patients to see about their efficacy and adverse effect, right? So investigator randomized identified the group to condition and observe the member of those community or those group to assess the effect of an intervention. Okay, so intervention means what medicine you are given. So you just see or do the assessment of the effect of those medicine in that particular community. Since you have selected that particular group or the community for giving the exposure to the drug, these type of the trial are called as the group randomized trial, or they are also called as community interventional trial or community interventional study. I hope it is bit clear to you, and you know now what do you mean by field trial, what do you mean by clinical trial, what do you mean by community interventional trial or the group trials. Okay, now we are done with different types of the trial, we have studied different design of the trial. Now let's see the last part of this, it is the application of the pharmacoepidemiology. So the first application of the pharmacoepidemiology, it is related to the practitioner. Okay, so that is the physician. Now let's see what is how it going to help to the practitioners. So the pharmacoepidemiological study, it helps physician, it helps pharmacists, it helps nurses and other healthcare practitioners to make proper decision about the patient treatment. Now we have seen in all four part of this pharmacoepidemiological study, we have seen the example of oral contraceptive. Now what decision can be taken by the patient? We have seen in case of the cohort study, the smoker and those women who are at advanced age, they are at high risk of oral contraceptive. So what decision, how is this study helping you to take a decision? So if you have updated knowledge of that, you are as a physician, pharmacist or a nurse, if you are going through the result of all those trial, then when you are giving the medicine, you will take a right decision that this oral contraceptive can be given to the sexually active women who are below the age of 40 and who are not a smoker, right? So this is how it helps physician, pharmacists and nurses to take the decision. Secondly, it also helps physician in evaluating and improving the prescription. So it might happen that the physician may be prescribing oral contraceptive in his earlier phase, right? But now after looking at the result of the trial, now he will stop prescribing this medicine, especially those women who having the age, or those women who are in the 40s, or maybe having the age more than the 40, or those women who are the smoker. Okay, so this is how you have filter your prescription. Now you have identified the risk, so based on that, instead of oral contraceptive, now you can start prescribing some other method of the contraception. So this helps physician in evaluating and improving your prescription. Secondly, it also helps government agency and healthcare to plan and take certain decision. For example, it helps such government agency to decide on the policies and public healthcare plan. Now let's look at the example of COVID-19 vaccination. So when the epidemiological study was done related to the COVID-19, so they have identified that the COVID-19, the high risk patient are those who having comorbidity, like who having the diabetes, who having the hypertension, who having cardiovascular disorders, and those patients who having the age more than 45 years. Okay, now, so this was the result of pharmacoepidemiological study related to COVID-19. Now, based on this study, now government agency and healthcare agency, they have planned that the priority should be given to those patients who having the comorbidity and those patients who having the age of more than 45 years. So how they have come to this decision? So now if you want to take the vaccine, then your age must be 45 years, because these are the patients who are at the high risk of COVID-19. So how a government agency has took this decision? Based on the result of pharmacoepidemiological study. Okay, so based on the result of pharmacoepidemiological study, it helped such as agency to decide the policy. So they have made the policy for the COVID-19 vaccination. So they have prioritized and to design the policy related to public and to decide on public health care plan. Okay, so this is the benefit to the government agency. Let's see what is the benefit to academician or maybe to the students who are doing the study. So you have the very good opportunity to conduct pharmacoepidemiological study to answer many questions related to utilization of the drug. So now you can see you are one of the student group in final year. They are working on specially the knowledge, perception and attitude of the Indian population towards COVID-19 vaccine. Okay, so now why these people are doing this research? So this is pharmacoepidemiological research. Why they are doing that? To know that what is the awareness related to vaccine, what is the attitude people have, and what is what we'll say the perception these people have, so that the strategy can be framed out for appropriate vaccination process. Okay, likewise there are certain set of epidemiology study you can conduct, like which is related to the drug given in the Alzheimer, drug given in the depression, and you can see how it produce or what is their awareness, or how those patients who are taking this drug, how those patients are responding to this drug. Okay, so there is good opportunity to academician to conduct pharmacoepidemiological study to answer many questions which are related to utilization of the drug. Okay, so this is the benefit to academician. Then there is benefit to the patient. So what is the benefit to the patient? To learn about the safety and effectiveness of the drug product. So benefit of the patient, it is this: they will get after pharmacoepidemiological study, the patient will learn about the safety and effectiveness of the drug product, and patient rely on pharmacoepidemiological study. So this is the advantage to the patient. Okay, let's see what is the P study, different type of P study that we can do. Like one of the P study could be the new vaccine and the device. What is the effect of the new vaccine and the device on the patient? Then drug induced birth defect, so that also you can do. The risk management, then medication error. So these are all you can study by using pharmacoepidemiological study. So these are different types, like new vaccination, device, drug induced birth defects, how you can study this. So let's take example of the drug induced birth defect. So if you want to study this, what you need to do is you need to go into gynecological ward, and there all newborn baby who take the birth, and they have their medical records. So you can check their medical record. You can also check the medical record of that mother who has given the birth to that child, right? And what medicine she has taken, and try to establish relationship between that drug which was taken by the mother and the birth defect which is produced in the child. So these are not a short-term study. You need to take more efforts, and these are very long time and tedious study that can be done in the hospital. Likewise, you can do study related to risk management, the medication error in the hospital. Okay, so these are the different type of pharmacoepidemiology study you can conduct in the hospital. Next application, it also help you to study the drug utilization and drug utilization review. How drug it is utilizing in the patient, or how what is the trend of drug prescription in the patient, which is prescribed by the physician, right? So you can do that, and when you are having all those data related to drug utilization in different part of the country, then when you are analyzing that data, that is called as the drug utilization review. So these two parts we will see in the detail in next part of our session, but this is also one of the application of pharmacoepidemiological study. So I have done with my today's session. So I have collected this in a slide deck from the Pharmacoepidemiology, which is textbook edited by the Brian L. Strom, 3rd edition. The page number it is 3 to 26. So I must thank the author of this textbook for providing the wonderful information related to pharmacoepidemiology for the benefit of the student. Okay, so thanks for watching my session. For more such learning, subscribe to my channel, and if you like my session, then do remember to give me a thumbs up.